this is working. I'm just gonna have to put this here. It might get crazy here in a second. Let me know if you can see what I'm looking at and what I'm seeing. I am currently working remote today because basically my kids' daycare was closed because to the extreme weather. So if you hear some crazy barking or some crazy noises, it's likely that it is my son. I'm also right now trying to keep my eyes on my texting line because now that I'm using my phone for this, at least I think I'm using my phone for this, wanting to make sure I put you over here, making sure that my people are here and can see me. So if you can see me, shoot me a text or shoot me a line so that I know I'm not talking to the abyss. I also want to, oh, perfect. Thank you, Ben. Okay. I also, because I'm not in my studio, my normal studio, I also don't have the technology to have my phone line here. I don't have the technology in my phone line, so this is what I have. It might be backwards for you guys. If it is, I'm so sorry. But if you want to text me throughout the show, you can do so here. Funny story, the last time I had to do a Medicare Cafe from home, I did it, and my husband just saw this on my desk, not recognizing that it was my work phone, and was just like, who's asking you to text them with this like handwriting? And it was really funny. Funny after the fact, I should say. But anyways, guys, welcome to the Medicare Cafe. Again, I am remote today. My son's daycare was closed due to the weather, which really didn't do a whole lot here in mid-Missouri, but I guess I understand wanting to be safe and whatnot. So today, because we are starting a few minutes later, I do want to go ahead and just kind of get into it. Is my camera clear? I wasn't expecting to do this. I have a really nice webcam on my computer and everything was great. And then my computer is like, not today, girlfriend. And I respect that because sometimes I don't feel like working either. So today, I have Medicare Cafe broken up into 3 segments. We're going to be talking about some industry insights, what's going on in the world. We're going to be talking about the tip and the week, making sure your clients are staying updated. And we're also going to be talking about what's going on with Medicare Part A and Part B and why is it getting so delayed. Again, just a reminder, my son is also home. If you hear a wild animal, it's likely him. He might be making an appearance. He's not invited, but he never is and wants to make his appearance known. So if he comes up, sorry, he's adorable. Let's talk about the agent question of the week. What is going on? Agent of the question of the week today is going to be talking about the Part A and Part B enrollments and what's going on with that. So basically, we work with some of our top agencies and they're all seeing the exact same problem, and that it is taking up to 6 months. When somebody decides they want to go ahead and take out Medicare Part B, they're saying it's taking 6 months for them to actually enroll in Medicare Part B. They put in the application, they don't hear back. One of these being that is likely because it is, again, understaffed. A lot of things are being investigated right now. But in the day, what's going on? The problem with this is that when somebody is delayed Medicare Part B enrollment, it's meaning that they're getting delayed their Medicare Advantage plan. They're getting delayed their Medicare supplement. And unfortunately, what that means is whenever that delayment is happening for 6 months, Medicare Part B or Social Security will go ahead and delay that enrollment or go ahead and backdate that enrollment, and the individual will have 6 months of backdated premiums that they have to pay. So it's been a really big struggle for most. We have some agents that are saying like, here are some easy ways to troubleshoot that. One way is to make sure that they get a letter whenever they go and apply for Social Security. Sometimes it's better for them to do it in person and get a letter whenever they apply for that stating when the Medicare Part B effective date is going to be. Oftentimes when you're applying for a Medicare supplement, especially it sometimes does work for Medicare Advantage plans, they'll go ahead and if they have proof that the Medicare Part B is going to start that day, more so on the supplement side, they'll go ahead and process the application and get that supplemental plan approved, making it easier for them, making it less stress for somebody to get those enrolled. The other thing that people are doing, I've heard this from a couple agents, is that they're using their verbiage when they're on the phone with Social Security to ask for a Tier 2 advisor. Apparently a Tier 2, supervisor. Apparently a Tier 2 supervisor can oftentimes get those pushed through and does have the ability to, does have the ability to kind of get those done. Use sparingly. That doesn't happen every time. Number 3 is sometimes people are separating part A and part B. Okay, I am seeing that some people are saying they don't see me. Yeah, Brian sees it, so that's good. Okay, good deal. Yeah, Brian, what's going on in the comments? I have no idea. No one's ever this nice to me, so I know they're not real people, right? Okay, so again, when it's coming from applying for part A and part B, just knowing that oftentimes when people are doing those separately, they're applying for part A and then applying for part B. People are saying that has gotten them more a faster turnaround to getting that access. So that's the agent question of the week. Why is it taking 6 months, and what happens when it takes that long for my clients to get their part A and part B? Now you know, and hopefully that you have some updates on how to get that taken care of. The second segment I wanted to talk to you guys was industry insights. There's a ton of stuff going on right now on the industry insights, making sure that like what's going on, obviously, with RFK getting voted in and getting the position of Youth and Human Resources. Also, we just came back from the ICMG. We also are going back from ICMG, and there's a lot of political and legislative discussions going on there as well. So just giving you an idea of like what we're kind of seeing. Number 1, ACA. Is it making a comeback, and is it for the right reasons, right? So whenever the Trump administration took over, we knew that a lot of individuals are really nervous about the ACA industry because a lot of the tax incentives for people joining the ACA and those reasons for doing that were likely going to be limited or even possibly going away. So a lot of people were nervous about what was going to happen to the ACA industry. A couple really interesting things and some studies that have come out since the Trump administration has taken over. Number 1, it's very likely that the short-term medical plans will be making a comeback. Again, the Biden administration, as we knew last September, basically said no more. We can only do 3 months at a time, requires re-underwriting every 3 months for the short-term medical. It is likely that we're going to see a comeback in those plans. So there's a good opportunity for you there. The other situation that we might be seeing going forward is talking about the use of insurance agents in the enrollment of the ACA. They have found out that the ACA and the navigators, reminder, what is a navigator? A navigator is an individual that is not a licensed insurance agent, but is somebody who is employed to help people navigate through the ACA website, the healthcare.gov, help people navigate through the enrollment process. What they are saying is that in that process, the government budget for navigators last year was $98 million. And they are looking to actually slice that budget down to $10 million. So that is a huge swing of money that is going to be allowable for navigators to do their job. They saw that navigators was actually one of the number 1 causes of waste, and basically were the biggest money capabilities, or where all that money came from for the ACA, and they're going to see huge cuts in that this year. What that means for you as an insurance agent is that you will now basically I'll say it like this. Studies are showing, and what the ACA is finding, is that insurance agents are 300% more streamlined, more money saving, more efficient than using a navigator. And so that is a huge opportunity. It shines a really great light on insurance agents and allows us to really put a light on what AA can do and how we are a cost efficient way of enrollments. So huge ACA things coming down the pike. Here we go. Again, Pam, exactly. Of course, agents are better. We have the data to really show that now. It's really exciting. So that's one thing. A couple other things I want to mention of what's going on in the industry right now. Medicare.gov. We all know that Medicare.gov does have some looking at like what is the best way of enrollment. Medicare.gov has had an enrollment platform on their website for over a decade, like for the last 15, maybe even longer than that. there is a lot of discussion about sunsetting the enrollment and plan checking capabilities on Medicare.gov because they're finding that most enrollment of a person over the age of 65 or a Medicare beneficiary is coming from third-party platforms or even the carriers directly. And so they're finding that it's not really efficient, nor is it helpful to the consumer to have Medicare.gov as an enrollment platform. So that's not that something, nothing is really going into like effect with that, but just knowing that it is likely or is in discussion that sunsetting the Medicare.gov enrollment platform in favor of those third-party platforms that agents are running. Really, really good news for us as agents today. The third thing, again, I debated even bringing this up because I don't want to cause panic. I don't have a lot of details behind it, but I will throw this out there so that if you hear of it, you can know kind of what the merit is and the credit is behind it. There is discussion currently about making Medicare Advantage the default enrollment when a person turns 65. Right now, when a person turns 65, right now they're enrolled into Original Medicare. There is discussion about turning that Original Medicare enrollment into a Medicare Advantage plan. You then have to elect to disenroll from that and stay on Original Medicare if you want to go the supplemental route. So that is an option. That is something that's being talked about. Do I think that's actually going to go through? I don't really know. Not necessarily. I think it could potentially be discussed again because of looking at the efficiencies on programs, looking at the efficiency, more so focusing on the cost efficiencies of programs. We're seeing that Medicare Advantage plans do manage the cost of Medicare at a slightly higher level. So I don't know what's truly going to happen, but just know that is something that's on the table. Will it go through? Not likely, but just something to keep in mind. So those are the three things, again, talking about what's going on in the industry. The last segment I have for you guys today is talking about educating your clients and what exactly are your clients caring about, right? We are super lucky to have a partnership with Deaf Research. Deaf Research is a organization that is starting to look at ACA and get more involved with them, but has been working with Medicare beneficiaries for years and years and years, the best research facility out there. And they look at the buying, what am I trying to say? I'm getting so distracted by the comments right now. I'm so sorry. This is wild. But I'm looking at how Deaf Research looks at buying behaviors of people over the age of 65 and what they're seeing with that. So a couple things that we're seeing, just a reminder, guys, what's going through people's minds right now? Just in general, Deaf Research has published a couple articles. I mentioned them in the past, but just kind of putting that out there. A reminder that Medicare beneficiaries, Medicare Advantage beneficiaries, their happiness with their plans have dipped 10 points or 10 units, however is measuring those. They've dipped 10 points since 2024. So people are really unhappy or less loyal to their Medicare Advantage companies than they've been in the past, which typically leads to more shopping, typically leads to paying more attention to those commercials, more likely to answer questions over the phone. Just there's less loyalty to the carriers this year, so keep that in mind. This research specifically looked at the Part D. We knew that this year Part D was one of the major drivers of change going into AEP, and because of the Inflation Reduction Act and other things associated with that. They're finding out that beneficiaries are less likely to pay any attention or incredibly not satisfied with their Part D coverage, which is why you're seeing carriers that have maybe $0 premiums or low dollar premiums outproduce or outright carriers that are going to have a higher premium but have a much better formulary and much better tier schedules. And so, for example, just so we know, 16% of beneficiaries that were interviewed do not see value in their Medicare Part D, and they're opting into using drug discount cards because they're looking at the short-term gain versus the long-term gain. Many beneficiaries aren't even thinking about a $2,000 max out of pocket on their prescriptions. They're only looking at their monthly premium and what it costs them that day to go to the pharmacy. And oftentimes when they're on these $0 drugs or $0 premiums, the drug discount cards, think Good RX or Clever RX, are going to be a cheaper option for them. Maybe not for the year, because we know, again, that $2,000 MOOP and all the other things, maybe not for the year, but in that moment at the pharmacy, the drug cards are cheaper. So a lot of individuals are looking for really cheaping out on their drug coverage, looking for a Clever RX or a Good RX, an alternative to that. Another thing that was really interesting is that, yes, that might be a good option for your clients today. Again, it might be the good thing for them if they're looking at, I'm going to go to the pharmacy, how much am I going to pay? However, last year in 2024, 26% of seniors got a new diagnosis or a change of health that affected their prescription needs. So just keep that in mind. When we're doing as an advisor is we're looking at them for the year, looking at their risk and making sure they understand how comfortable they are with those risks. So again, I think George Dipple from Death Research put it perfectly that even though us as insurance agents may not think that discount cards are a better alternative, anything is better than nothing. So making sure you're having really good conversations with your clients, making sure that you are using today to talk about your value add throughout the entire year. Because if people are listening to the internet, if they're doing their own research, they may be getting terrible advice of what to do for their prescription drug plans and for their other coverages as well. So now is the time. We are looking at that 2026 AEP, guys, is going to be just as wild as 2025 was and beyond. There's also already a lot of talks about SARs. There's a lot of people out there thinking that all those companies that went suppressed or all those companies that went non-commissionable, they're going to be SARs in Q4. Again, I don't know that. I haven't seen the data to back it up, but that's the word on the street. Just understanding, guys, now is the time to talk about this stuff with your clients, to talk about their drug coverage, to talk about these alternatives, to prove your worth all year round so that come Q4, you are the obvious answer on who to work with. So that is what I have for you guys today. Those are, again, what we're seeing on the buying structures for Medicare Part D and Medicare Advantage plans. We know Medicare supplements are going to continue to see a crazy year with the crazy rate increases that we're seeing. So just understanding what's going to happen this year, how can we as agents be prepared? Reminder, guys, if you're working with your individuals who are trying to enroll in Medicare Part B, get that letter. And make sure they understand, guys, it may be 6 months and prepare for that back date of premium. That is what I have for you guys. Again, I don't know what happened with the crazy commenters, how hilarious, probably just because I did something wrong to let the wild people roam onto my live. But appreciate you all. Again, we go live every Tuesday. Make sure this is recorded. We will be posting the recording of this because it's live on YouTube. So if you missed any of it, watch the recording. Appreciate you all so much. And I don't even know how to end the live, but I'm going to try. Until next time, guys, have fun, make money, and give impeccable service. What? Okay, I don't know. Thanks, guys.